All right. So the next group of drugs are the glycoprotein 2b3a receptor inhibitors, which are listed here. So what is the glycoprotein 2b3a receptor? It's an important receptor that really kind of um, produces kind of the final pathway in terms of platelet aggregation. So blocking this receptor pathway is really a good way to limit or restrict the growth of a clot. Um, and so basically, if you prevent this growth of a clot, you prevent more thrombus formation. You can prevent distal thromboembolism from occurring, and you can really kind of restrict this the activity of platelets. Because remember, once one platelet binds to a given area, it's a lot easier for other platelets to follow suit. And so these drugs really restrict that cascade or that signaling pathway. These are the three drugs that are classified as your glycoprotein 2b3a receptor inhibitors. Um, Abiciximab is the first one. This is a monoclonal antibody, and again, you can tell that by looking at the suffix here, MAB. Um, it's not really specific for the receptor specifically, but inhibits the receptor activity. Um, these two drugs, which are different in size, are much more direct and specific for the glycoprotein 2b3a receptor. So this is kind of a nice, summary table in terms of these three drugs. So let's talk about abiciximab. So we said, it's a primary monoclonal antibody, and it prevents platelets from kind of aggregating, specifically in patients that are undergoing balloon angioplasty due to suspected heart attack. And so you typically see abiciximab co-administered with aspirin. ASA is aspirin, as well as heparin. The plasma half-life is relatively short, and you see kind of receptor blockade for up to half a day after the infusion has stopped. And so what's nice about this drug is that the platelets, especially in some of these patients that are undergoing PCI, the platelets can be kind of a little heightened in terms of their ability to be activated. And so that whole activity can be severely kind of restricted for up to 2 weeks after this drug's been administered. These two drugs are kind of like small molecule inhibitors. They've got a little bit different kind of kinetic profile. And of course, there's some renal dosing adjustments in terms of renal insufficiency. But essentially, they work quite similarly with a much more higher affinity and inhibition of the glycoprotein 2b3a receptor. Okay. Let's end there, and we'll pick up on these antiplatelet drugs, which are listed here.